Hi, I'm Dr. Tasneem, consultant in Obstetrics and Gynaecology from Manipal Hospital Whitefield. Fibroid is the most common benign tumor in a woman, and it can be detected by 70% of the women. By 50 years it can be detected. Fibroid may be solitary, multiple or diffuse. Most of the fibroids are asymptomatic. 1 in 4 women with fibroids have symptoms. Most of the symptoms depend upon the position and type of the fibroid and where it is located. The symptoms can be excessive bleeding, dragging pain in the lower abdomen, urinary disturbance like frequency, urgency, pain during intercourse, pain during menstrual cycle, and also constipation. Fibroids are rarely seen before menarche, and usually it regresses after menopause. Fibroids may be associated with infertility. Subserous fibroid usually does not cause any problem for pregnancy. During pregnancy, there is an increased risk of malpresentation like breech, transverse lie, oblique lie. There can be premature rupture of membranes, preterm labor, and fetal growth restriction. Therefore, fibroid in pregnancy warrant additional maternal and fetal surveillance. After delivery, fibroid can also cause postpartum hemorrhage. Transvaginal ultrasound can detect 90% of the uterine fibroids. Fibroids are classified into the position or the location it is. If it is outside the uterus, we call as subserous. If it is in the myometrium, that is in the muscle of the fibroid, we call it as intramural. And if it is into the uterine cavity, we call it as submucous. Coming to the management, the treatment of uterine fibroid should be tailored to the size, type, location, age of the patient, symptoms, desire to maintain fertility, and availability of the service. In women who are asymptomatic and with bearable symptoms, usually expected management is done. Many women with fibroid have successful pregnancies. 3 to 7% of the untreated fibroid in perimenopausal women regress after menopause, usually over 6 months to 3 years. In any suspicious looking fibroids in transvaginal ultrasound or rapidly growing fibroid should be always suspected to be malignant. Symptomatic women who do not wish to have fertility but want to preserve their uterus can go ahead with either medical treatment, myomectomy, or intrauterine insertion, that is levonorgestrel intrauterine insertion. They can also have magnetic resonant guided focused ultrasound surgery or uterine artery embolization. Symptomatic women who don't want definite treatment and are not desiring further fertility can plan for hysterectomy, that is removal of the uterus. 1 to 2 hours minimal invasive surgeries are done here, and it's a shorter hospital stay, and you get world-class surgeons and infrastructure.
Get treated for many ailments in less than 24 hours. Safe surgery, matlab Manipal Hospitals, because our stars are our doctors. No more excuses.